It's all going to be worth it for sure. Okay, amazing. Jacqui Watts,
Yes,
welcome.
thank you.
Okay, so you are a naturopath, and that's the reason why I wanted to bring you on here for everyone because we
Yeah,
met at a networking event only like 2 weeks ago,
yeah,
and it
no.
was just like when you click with someone, you're like, I want to carry on talking to you.
Yes, for sure.
Yeah.
Definitely.
So, how long have you been in this industry? And then you specifically niched off into women's health, didn't you?
Yeah, correct. So I have been in the industry for 12 years now, and so I studied naturopathy, herbal medicine, and a diploma in massage, and started my clinic at various locations. And then around 6 years ago, probably after I had my daughter and realised, new mum and what it was all like,
Mm.
went off more towards women's health and understanding the hormonal side because I really felt like there wasn't a lot out there on that at that stage. And that was, obviously 6 years ago, a lot more information's out there now, which is fabulous. But it
Yeah.
definitely was an area that wasn't, wasn't talked about enough for sure.
No, especially not 12 years ago when you first started
Oh,
studying naturopathy.
yeah,
That's like a
yeah. There wasn't even, you couldn't even search anything on your phone then. There was,
no.
you had to go to a book.
Oh, good old books.
Yeah.
Oh, amazing. Well, welcome. Thank you so much for being
Yeah.
here, even though we're having a few glitches. That's
Yeah.
fine though.
That's okay.
Um,
We got there.
Everyone who have just joined, say hi. If you're watching live, say hello. Ask questions as you go. We're going to answer as much as we can. We'll try not to keep you for too long, but there's just some lovely stuff to cover today and throughout the week. Today we'll be talking about periods and hormones. Tomorrow's fertility, so that might be a bit longer. There's a lot more questions on that, it seems to be. And then we're going into PCOS, thyroid, and then menopause. So all good stuff, all good stuff. So let's talk about first, what's the difference between a naturopath and a nutritionist?
Okay, so a naturopath, there's some crossovers there. So we all sort of
Yeah.
study the nutrition side, and within my naturopath degree, I did herbal medicine as well. So obviously, nutritionists are practicing purely, food-based medicine and looking at more your macronutrients, so getting the minerals right and the vitamins right. Whereas naturopathy tends to be a bit more of a holistic approach. So we try and look at, what's going on for them on all different systems, with regards to the stress and the hormones and the gut, and really trying to nut out, how we can bring balance to the body as a whole, rather than, different nutritionists, especially clinical nutritionists, probably looking a little bit more at the specifics of, the proteins and the fats and the carbs, depending on the
Okay,
body.
yeah.
Yeah.
So just a little less holistic in their approach and their
Yeah, and
tailoring.
that's right. There is some great holistic nutritionists out there, so I don't want to
Mm.
discount, that side. But yeah, definitely can be a bit more clinical based, I guess.
Yeah, I suppose it's just for people to understand because there's so many different practitioners out there, and it's
Oh, for
just
sure.
finding
Yeah,
what works for you and what you
yeah,
should be looking out for.
yeah,
Um, let's talk about hormones because I know a lot of people, we talk about hormones, but what actually are they and what should be
yeah.
we know in basic
Sure.
terms?
Yes, I know. That's that basic.
Yeah,
So
let's go
I
basic.
always explain, I guess, the hormonal side of things is something that's produced by the body and attaches to your cell to trigger a response. So, obviously that can be things like fertility and your periods, but then we also need to think about our thyroid hormones. So that's triggering metabolism and energy and growth of
Hmm.
hair. So hormones are really stimulating an action within the body. So which is why we want that nice balance, because if one's deficient, then we're not getting the response that we want. So progesterone and
Okay.
estrogen and the testosterone are probably the main ones that we see in clinic and talk a lot about. And they all have obviously different amazing effects.
Okay. You mentioned being in balance. Is that quite a common thing now that people are out of balance?
Yes. So, I mean, I guess I'm seeing people with hormonal conditions in clinic, so they are going to be more likely to have imbalances. But when I do saliva testing, a lot of my clients send off a little saliva tube with, their spit, and we see what's going on with their hormones. And it's really very rare now that I get someone that's hormones are fabulous on paper before we do any treatment. So
Yeah.
progesterone's usually low predominantly, and estrogen's normally got an issue of being too high, is what I see
Okay.
trending. Yeah.
What do you think the reasons are for that? The imbalance?
There's some multiple things going on there. So low progesterone can be an issue with not ovulating. Obviously, the pill will stop progesterone production. And then another area I see is a lot of gut issues. So if the gut and the liver aren't working and clearing properly, they're not clearing out this excess estrogen and testosterone. And then there's just this huge amount in the body, and it's imbalanced compared to how much progesterone we've got, which brings a lot of symptoms, unfortunately, for people.
Yeah, okay.
Yeah.
You touched on the contraceptive. We'll do that in a sec, actually, because that's a big one. It's an important one we want to cover. What should our periods actually be like then?
Okay.
What should we? Because you mentioned symptoms.
Yeah. So, and this is where I think we need to remember. I see so many women that have had period pain or PMS for such a long time, and they think that because they've had it for a long time, it's normal for them, or their doctor's probably told them it's normal, maybe their mum and their sisters and friends. But I really want to start educating people on the fact that, period pain, there's a reason for period pain and there's a reason for PMS, and one of them can be the hormone imbalance. So what we'd like to see is around a 28-day to 32-day cycle, and then really the lead up to your period shouldn't be any issues with PMS or bloating, breast tenderness, headaches, anxiety. These things are all indicating a hormone imbalance. And then no spotting leading into your cycle. So often women will get, the few days spotting before, which is often a low progesterone sign showing up there. It really should start with a nice, normal blood flow, and mild cramping for me is considered normal. So there can be some cramping there, but it shouldn't be needed to be any pain relief or taking days off work or anything like that.
Yeah,
And
because
it's, I think this is where people will take a day off every cycle, off of work.
Definitely.
Or write themselves off for a couple of days.
I had a few friends who would just take 5 days off work. It's my period, this is standard, this is what I need. Yeah. I'm like, is this normal? Should we be in that much pain?
No, exactly. And I think unless anything, and that can be, there's nothing there, physically, so they might not have any endometriosis, there might not be any fibroids, there might not be any cysts, but there can still be, inflammation causing all this pain. So the pain, we shouldn't be having so much pain. That's definitely something we shouldn't have. So it should be starting off day one, medium flow, no clotting, no, bending over the toilet in pain or nausea or headaches, and really around a 3 to 5 day bleed. So any longer than 5 days, and I start looking at some hormonal stuff going on there. And it should finish off, so it shouldn't be this stop-start situation that some women experience as well.
Yeah, I mean, I speak to some people and they have a little bit of spotting, and then next week they have another bit, and they're kind of, it's irregular, it's confusing.
Yeah, that's right, and that's really just a sign of low progesterone. So the body hasn't made enough progesterone after ovulation. And it's not holding the lining properly of the uterus. So it's kind of just, showing signs of a blood flow, but then it doesn't happen. And that's where we need to work on the progesterone levels and ovulation for people.
Okay.
Making sure they've got healthy follicles and things.
Going it back to the contraception. So normally people are recommended to go on this because they've got irregular periods, or because they've got acne, or because it's heavy and painful. So then they go on this contraceptive pill.
And that's right. This is where we're seeing, the pill was originally designed obviously for contraception, but it also gave doctors that way of saying, we can normalise your periods. Because women feel like because they can stop their hormones for a few days, then they get the breakthrough bleeding. And they actually show that women felt better if they had so-called a period. But obviously the pill bleed isn't a real period. It's just the shedding of the lining due to the shift in the hormones. So I think women need to understand that it's not really important for them to have this monthly period. It's not doing anything for their health. It's not a real period. It's just a stopping of some hormones, giving them that release in blood.
So this is mind-blowing, because I always thought, because I was on the contraceptive pill from 16. It's the standard thing. You get put on the contraceptive pill as soon as you hit like time to, have sex.
Yeah, that's right. Well, that's
Um,
it. And even
yeah,
before
and you're
that,
just on
these
it.
girls from 13 with skin problems, like you said, and
Yeah.
heavy periods, irregular periods. Yeah.
And I
And it's,
thought the bleed,
mm,
the bleed was real.
was
I thought it was
real.
me giving it a
Yeah.
break. I can bleed, I'm
Yeah.
normal, and
Yeah.
now you're saying it's actually not
It's,
real.
no, that's right, because there's no ovulation to preempt that. So,
Okay.
yeah, and I think what we need to remember with the pill is that they've actually shown now it takes up to 12 years for our brain and our ovaries to start talking to each other properly. So there can be issues with, irregular periods in the early days, but that can take a long time to, get that connection working. This is where people come off the pill later on, and then they've got irregular periods and almost feel like they should go back on the pill to fix their problem,
Yes.
but they haven't given it long enough to really balance out and sort out the underlying problems there.
So you're saying it should take about how many days for it to get back into balance, giving your body some time to get used to not being on the pill anymore?
Oh, well, and this depends what the pre-pill, so we always say, why were you put on the pill? It can take 3
Right.
months, it can take a year for some women that I see to normalise their cycles. If we're
Yeah.
using, there's some great herbs we can use, and we look at, why the body and the brain isn't talking to the ovaries properly. And that's often where people, I guess, miss that point, is that, you can take all these things, but if your brain's stressed and under stress, it will be not able to talk to your ovaries properly. So usually stress is a big one there for ovulation and irregular cycles and normalising cycles after the pill.
Yeah,
Yeah,
definitely.
for sure.
I think a lot
Yeah.
of people don't realise that they are even stressed as well, because
Oh,
they say, well, I'm
definitely.
not stressed, it can't be a reason.
Yes, that's right. And, what I sort of say to people there is we often will get stressed, let's say 10 years ago, out of high school, we might be a little bit stressed and we manage that and we get used to it. And then, something else happens and eventually we're right up here, but our bodies have actually become accustomed to that and used to it. And so we're like, oh, we're fine, I feel fine. But these symptoms we're
Yeah.
experiencing have come over, 10, 15 years plus, especially for the women I see that are, menopausal age. And yeah, we're just not realising how we're feeling anymore. We shouldn't, we've forgotten
No,
what we feel like when we're not stressed, pretty much.
definitely. Totally agree. It's just
Yeah,
like
yeah.
crazy, isn't it? Elise says, I've been off for 1.5 years now.
Okay.
What was the reason you were on the contraceptive pill, Elise? Was it just share if you wanted to? Yeah, I came off the pill probably when I started looking into more holistic health about 5, 6 years ago.
Yeah.
Um,
And there's some,
yeah.
great things. And I think the main thing I think people really need to know there with the pill is that because you're not ovulating, you're not making your own progesterone, and progesterone is this hormone that women struggle with without, even if they're not taking the pill, we struggle to make it. So even if when you're on the pill and you're making no progesterone, progesterone is like our anti-anxiety hormone. So we're more prone to anxiety over the years, bloating, poor sleep, weight issues, because it will get out of balance, with our estrogen. So, long-term pill use, it might take 5-10 years for this to happen, but eventually there's going to be a decline in our progesterone levels and we will start seeing some, quite obvious symptoms, but we won't relate it to the pill because we've been on it for, half our life or something.
Do you think this is a link? You mentioned the anxiety thing being a link, but do you think
Yes.
this is a link between fertility issues that young people are facing now?
Yeah, I do think so, because I think what we need to remember is the progesterone's there to help the lining of the uterus maintain. And if people are going into pregnancy with low progesterone, which often they are, unfortunately, number one, there's more chance of miscarriage, unfortunately. But then if they're not having strong periods, and when I say that, I mean like a good ovulation and good amounts of progesterone, they're not building up that lining properly and they are more likely to have trouble conceiving. So I heavily recommend people get their progesterone tested before, and from a saliva point of view, I like it to be 1,000, if not 1,500, and most women I see are around the 200 to 400 mark generally.
Wow, that is crazy
So
difference.
very rarely would I ever get someone tracking very well before we do herbal and nutritional treatment with them. So it's very common, very, very common.
Okay. Elise coming back to us, she said she was put on the pill because she was young, she had acne and a lot of pain. So this seems to be a common thing, that you just get put on the pill for that.
Yeah, yes, for sure.
And I suppose it does help with the acne for that time that you're on the pill, but some people actually
It does. Well, that's right. And it's suppressing, it's an androgen. So the progestin in the contraceptive pill is actually closer to an androgen, which at the time it will stop the acne and the issues. But what a lot of people find is post-pill acne. So they get off of the pill and then obviously their skin comes back. This needs to be given around 3 to 6 months to get out the system, and some good detox, some good liver and gut health, because often then people think, oh, my body's gone back to being acne prone and I'm going to go back on the pill.
So take it again. Yeah.
Exactly.
Or they go worse.
Yeah.
They take the Roaccutane.
Yes, exactly. And then their guts, ruined as well.
Ripped. Yeah.
So, and the pill obviously is destroying the gut lining. So, gut microbiome's dropping. They're not having that good variety of bacteria in their gut, which leads to their own sort of hormonal problems and anxiety and mood disorders, depression.
Yeah.
All sorts of
It's like
things.
taking another antibiotic, isn't it? It's just a different antibiotic sort of style.
That's right.
Sorry, Elisa said, and doctor said I had to go on it. Back then, I didn't understand what effects it had. I was on it for 10 years. Yeah, we aren't told.
No.
It's just
very
a standard
rarely
thing.
do I get someone in that understands the side effects. And obviously we're not given choices. A lot of the time it's not that we're not talked about, the temperature method or, monitoring our mucus changes and, ovulation, and there's only really a few days we can fall pregnant out of the whole month. So if people are becoming a bit more aware on their cycles, which is what we want happening off the pill, then, there's still, if it's tracked properly, the fertility method really is like 7% accurate if done properly with the temperature and the mucus changes. So, but it's not talked about.
I think you're right there, though. It's the information. It's that we're not, people need to be able to make up their own mind. Like, here's the contraceptive pill. This is what it can offer. Here's this. There's an alternative.
Yes.
And then they can decide.
Yeah, for sure. And sometimes, I see people that have been on the pill, they've had endometriosis. And this is another area, unfortunately, they're often put on the pill, back on the pill to control the endo, but it's not getting to the underlying problem. And my concern here is, okay, maybe what we would do is keep them on the pill for 6 months, balance everything out as much as we can and get them ready to get off the pill. So if people are nervous about getting off the pill for reasons, sometimes I encourage, just spend 3 to 6 months getting a bit healthier, looking at your stress, doing some gut stuff, do all you can, and then when you get off the pill, usually that transition is a bit easier to come off rather than just stopping when your body might be feeling still a bit of a mess. Yeah.
Oh, that makes sense. That's a nicer way of doing it, maybe, especially if someone's been on it for 10 years plus.
That's right. Yeah, it can be quite a transition, for sure.
When I mention about contraception to people, they ask, what can they have instead? Like, it's a no for the contraceptive pill. What's the other options?
That's right. So, well, in regards to the medical side of things, there is the Mirena, and if someone was going to do anything, that's probably the one that naturopaths, I guess, maybe encourage more, only because it will still let your ovaries ovulate. They say 3 to 5 times a year, depending on the person. So there's still some ovarian activity when you're on the Mirena, and it doesn't. It obviously doesn't affect the gut as much as the pill. It still will have a bit of an impact. But really, I think there's the DAISY method now. So there's the actual device you can buy, which is the temperature method, which plugs into your phone, and it will start tracking your cycles. So again, this is like 8 or 9% effective if used correctly. And just by tracking your temperatures throughout your cycle.
So you have to buy a separate thing called the DAISY method, and it attaches to your phone?
That's right. Yes.
Oh,
so it's just, actually, I think it might just it's just an app, so it will just, sync over to your phone. And they say to use it for 3 cycles, obviously with some sort of protection, condoms or avoiding sex around that time. So it can learn your patterns, but then it will give you, like, I think it's an orange or a red for no, and then a green for go sort of thing. And this is a really good way that women can start learning about their cycles and their temperatures and how it affects them. And a great way to realise if you're ovulating so late. Some people don't ovulate at day 14. Some people ovulate at day 23. They've got problems. So with ovulation. So they
Okay.
might think they're trying to have a baby and they're trying to around day 14, but they might not be ovulating till day 23, or they might not be
Oh,
ovulating at all in their cycle. You can have a
so that
cycle without a period without ovulation as well.
oh, so they're downloading these generic apps, thinking that okay, this is the day I'm gonna
Yep.
ovulate on. Let's do this,
Yeah,
and
yeah,
then it's not
exactly.
actually their
No, it's
body.
far from, yeah. I mean, it's said to be the more normal around the day 14 mark, but it's not abnormal, maybe day 11, day 17. So there could be a window here where people are missing and they're trying to fall pregnant and they've just, totally discounted a few days in their cycle that are fertile and not learning
Yeah.
to read their mucus changes and things. And yeah, so learning, I
Wow.
think women need to really learn their bodies a little bit better, and we need to be educated on, our signs and our symptoms so we can feel those ups and downs in the month and get to know our bodies a bit better, which we can't do obviously on the pill because it's blocking all that hormonal function.
Yeah. Yeah.
Mm.
Oh, interesting. What it's crazy, isn't it? You could just go
I
into
know, I
different,
love
so many different
it.
things. And I know
Yes,
we're doing fertility tomorrow, and I want
I
to make
know,
sure
I
we're covering
branched off a
everything
bit
today.
there.
But it's
Yeah.
like, no, it's so good. Um, what was I going to say? What? Oh, lost it. Has
Okay.
anyone got? I've got Elise. Yeah, Elise mentioned she's just gone, but she said she noticed anxiety was worse, and she just had awareness of her body
Yeah.
more once she was off
Yes.
of it.
Yes, and that's interesting, I think, and I see this a lot where people get off of the pill and then they actually feel that anxiety spikes even worse because obviously those hormones are trying to transition and
Mm,
that can take a lot of time. So it's not uncommon to come off the pill and feel anxiety, but what we need to try and do there is obviously re-establish the ovulation and a regular cycle so her own
yeah.
hormones can take over and balance out a bit.
Yeah, because then
Yeah.
it ends up leading to, okay, I've got anxiety now, I need to take a medication for this anxiety,
Oh,
and it
that's
just
right.
spirals out of
Yes.
control.
Yeah. And anxiety is just a whole other, subject on itself that I see a lot, unfortunately, but there's an
Yeah.
underlying cause. If people are getting anxiety for no known reason, so if people are waking up anxious or sitting at the desk in the
Hmm.
middle of the day feeling anxious, there's a biological reason why that's happening, and that needs to be addressed, whether it's the cortisol or the progesterone or
Yeah.
neurotransmitters or something going on.
Yeah. Talk to me about, have you had, let's have a lovely story that you've had with one of your clients that
Yeah,
you've helped.
okay. Yeah, of course. So, one comes to mind, a woman who, quite a stressful job, high pressure, sort of high work hours, came to me with anxiety pre-period and around ovulation, noticed some change in mood as well, and a lot of like bloating and breast tenderness, some gut
Mm,
problems. And then when the period came, that was quite an event as well, so quite painful and heavy. So her ovulation was fine. We did her hormones, and her progesterone showed that her levels were high enough that yes, she was ovulating and producing some progesterone, but it wasn't quite high enough. But her estrogen was quite high. So we spent a lot of time looking at her gut and her liver health and the food she was eating to really clean up all that environment and let the body get rid of, any excess hormones.
mm,
And we worked a lot with her stress levels, so educated her on, different stress management techniques such as meditation and yoga and, all that good self-care.
yeah.
And from that, it took around, what would it have been? Maybe like 5 or 6 cycles to have an amazing period. So it was getting better all the time. But we just had her back in clinic a few weeks ago, and she'd had a really breezy period. There wasn't any lead up problems. It just kind of came out of the blue, and no anxiety, and a lot of that was just her putting all that work into doing, a lot of diet changes really came from that. So she did a fantastic job with addressing her diet and her stress,
Amazing. Oh, I love
which was
that.
great.
Yay.
Yeah,
It's
that's
such
the
job
good side.
satisfaction for you as well, isn't
Oh,
it?
it's huge. Yeah, very good, and it's
Yeah,
very very rewarding for sure.
lovely.
Yeah.
Talking about food, now
Yes.
I didn't think that I had painful periods. I
Yeah.
thought they kind of came and go. I had those cramping. I never really had any
Yeah.
issues with periods
Yeah.
until I decided to tweak my diet a bit more,
Mm.
like totally remove sugar
Yeah.
for a month or so and just increase my good fats. Now, I'm not
Yeah.
saying follow keto, I just
Yeah.
changed that way.
Yeah.
And
Yes.
my period just came and went. I didn't even notice on the day. I was like, wow,
that's right.
there's
And that's how it should be.
So
And I think, sorry, you go.
no, definitely, it's how it should be, like you were
Yeah.
saying. I think the thing is, when we do have those painful days, we're just like chocolate fiend. Let's just drink because I just want to numb the pain, and I'm feeling like I'm craving all this sugar stuff. But it's actually going to hinder you.
Exactly. That's right. And that's And I think sometimes, like you said, it's yes, it's the food you're eating when you're on your period. So obviously try not to have the sugars and the coffees and things. But, as we talked about when we had our sort of catch up earlier, is that the follicle, that takes that 100 days to develop. So how you're treating your body really for up to 3 months before each period is going to represent what your period's like. So, obviously you've had a great experience because your diet was probably not too bad to begin with, that the month made a big difference to your period. But some women really notice it takes that 3 months to clean up their diet. First, get rid of all that inflammatory foods. The coffee and the alcohol is a big one, I find, for women because it's so inflammatory. And for sure, obviously when you've got your period, we want those easy to assimilate foods, maybe some smoothies, bit of pineapple and ginger, anything, clean and fresh that's not going to be triggering any more inflammation in the uterus.
Definitely, some anti-inflammatory good stuff.
Yeah, that's right. Your good fats, like you said, your avocado, nuts and seeds, and all blended down so you can absorb it well.
I love that you brought up, the Christmas period, the January 1st, everyone celebrates, and then it seems to hit everyone where they've got bad periods afterwards. And you're
Every
like,
year it
that's
happens.
why.
Yeah, they come to me in January, February and say, oh, my periods have been terrible, I don't know what's happened. And then we talk about all of that, and they're like, okay, which is good. It's a realization for women that,
Definitely.
Their diet, especially if they've had a good year with their diet, we've done a lot of work with their diet and their health, and then they have a bit of a fallback. It's a good reminder, I guess, as to how powerful the diet is with the hormones.
Yeah, it's good for them as well, just so they understand their body better as well, I can imagine.
Oh, definitely. It gives you more motivation.
So I've got a comment from Stacey. I haven't been on the pill for over 6 years. My daughter is 4.5. Since I turned 35 last year, my periods are 2 to 3 weeks with awful PMS. My poor family. My diet's really good. Final year clinical nutrition student. Thinking maybe hormone testing could help to treat naturally, question.
Okay. I would presume, and depending, I'm not sure if she's getting ovulation signs, but it sounds like there might not be a good ovulation happening there. So we would want to make sure maybe you could do some ovulation test strips, or tracking your temperatures throughout the month and having a look at if you're getting the drop and then the rise of the temperature. Because if you're getting a shorter cycle, we would presume that you're probably not ovulating, and you're just getting this shedding of the uterine lining too often, and you're not having that progesterone to stretch out the length of your period. So unfortunately, obviously you're in a big year of study, and I would imagine that would be heavily impacting on your stress and your brain and how your brain communicates to your ovaries. So there's some really good like stress herbs, some rhodiola or withania that you can use.
Ashwagandha, any good?
Yeah, that's right.
She mentioned that she thinks stress is a big factor for her, which is understandable because it just
exactly.
Even realise.
Yes.
Yes, ovulation signs, but more like day 8.
Okay, so too early. So we'd probably, unfortunately it's probably the stress. So if day 8, so she's probably getting that longer. If you were going to do hormone testing, what we'd do is we'd make sure that she was ovulating. And then if we knew that day, then it's normally a week after from ovulation that we would test. So she could see if her estrogen was really high or if her progesterone was low, and the balance between the two, and maybe even testosterone, depending if she was getting any testosterone-based symptoms in the way of like facial hair or anger, acne, things like that.
That's good to know. So if it's high testosterone, it's facial hair, acne. Anger. Frustration. That's good for people to know. So does she get that Daisy thing that you mentioned about the testing the temperature?
Could. Well, I'd probably just get some LH, some like ovulation test strips from the pharmacy, just to confirm that day 8, because she might be getting mucus changes. So Yeah, and you can't really know if the ovulation test strips you get from the shops, they're going to tell you if your brain is producing the hormone to ovulate, but it's still not going to tell you if you've definitely ovulated really well. So ovulation strips are a good place to start. There is a new test now called Prove, Proov, which is a progesterone dipstick as well that you can buy online, and that will test your progesterone like a week after your ovulation signs to see if your progesterone is getting high enough. So that can be a good indicator if, rather than doing saliva testing, obviously we don't want to do that every cycle. These little strips are really good to see what's happening post-ovulation and if you're ovulating properly and what we call like strongly and effectively. That might be worth a shot as well.
Nice. I hope that's answered your questions, Stacey. Thank you for asking.
Thank you.
If anyone else has any questions, please feel free to drop them below. Jacqui and I will be answering them over the next 24 hours or so. This will be a podcast as well, so if you haven't managed to watch this, it's going to be converted to podcast. Some people prefer just listening and not looking at our beautiful faces. But we're going to be here every day for the whole week this week. Tomorrow is at 4:30. And we'll be talking fertility, so we might be on here for a little bit longer.
Yes.
But Jacqui's kindly shared us a few little goodies, and it's going to be in the podcast vault that I have for anyone who I interview. The information will be on there, so it's worth checking out, and it's just bit.ly/podcast vault, and I'll pop the link below as well. Jacqui, thank you so much.
You're welcome. Fun.
Yay. We won't have any problems tomorrow because we're all sorted with our IT.
Hopefully.
Okay, amazing. So
Excellent.
No more questions. We're gonna leave you guys to it, and we'll keep answering if you have any more questions to go. Tomorrow is fertility at 4:30, so hopefully we'll see you there tomorrow. Fabulous. Thanks a lot.
Alrighty.
Bye.
See ya.